So my guest today is Dr. Alekya Singapore, a leading dermatologist from our very own Hyderabad. A lot of people come to even a physician like me with a lot of skin related issues. Some allergies, to darkening, to pimples. Some things I can treat. But after a point, my expertise is limited.
Yes.
So is a surgeon's expertise limited in dermatology. Likewise,
So is the
dermatologist's experience is limited.
Yes.
So there are many chronic health issues like diabetes, which have insulin resistance, which show skin changes.
Yes.
There are thyroid related issues
Yeah.
that show subtle changes on the skin.
Yes.
Iron deficiency with changes in the nails, sometimes hair loss. What are the earliest signs that you encounter, or in other words, what patient comes to you with which tells you that yes, this could be diabetes or thyroid or liver or kidney?
Yeah, that's actually a very interesting topic to start with, is what I feel, because they say the earlier it is always the better. And skin, most of the people come when things are really worse or bad, or in a place where it takes a little longer for us to treat. Usually skin hair issues అనేటివి చాలా టైం పడుతుంది హీల్ చేయడానికి. And patients don't have so much of patience, especially in dermatology.
Patients don't have patience, number one, and they want to wait till the very end,
and then
they come and they
done.
want to be treated quickly. Yes, we definitely want to treat you quickly, but we
body
have our
has
limitations, and medication requires some
body
certain
and
time.
skin has it, especially when it comes to skin and hair, it has its own way to heal. There are ways we can speed up, but coming back to the question of how do we find out the early signs in skin. When you're looking at insulin resistance or diabetes or thyroid also in that case, what usually people come with, increase in the number of skin tags. ఎన్ని రోజులు ఒకటో రెండో ఉండేది ఇప్పుడు చాలా పులిపిర్లు వచ్చేసినాయి, మెడ మీద ఉండేది ఇప్పుడు ఫేస్ పైకి కూడా వచ్చేసింది. దట్ ఈస్ వన్. సో నాట్ ఎవ్రీబడి హూ హ్యాస్ స్కిన్ ట్యాగ్స్ మీన్స్ దే హ్యావ్, బట్ ఇట్స్ బెటర్ దే గెట్ ఇట్ చెక్డ్. And that's one of the very early signs, like a tiny sign but a very early sign. Second thing is darkening of the neck, which people think is very common. మెడపైన నల్లగా వెనకాల ఉండడం. For females they think it's the chains that they wear, or for males they think it's the collars, or plus చెమట వచ్చినప్పుడు they just wipe it off. So they just think it's a normal thing, but actually it's a sign of insulin resistance even in females or males. Darkening of neck, darkening of underarms, plus already dark circles ఉంటాయి ఇంకా డార్క్ అని. More than darkening, I should say thickening of your skin. You see folds also getting darker. So folds of your neck నల్లగా ఉన్న మళ్ళీ దాంట్లో you'll have like a cut like folds in the underarms, under the eyes. So those will definitely indicate I would want people who think they have these signs initially to go for an insulin resistance check. Now patients don't know what insulin resistance, they can ChatGPT it, they can Google it, but always it's better to visit a physician to get your insulin resistance checked. And other thing is facial acanthosis అంటాము. They think face లో ఓన్లీ sides కి మాత్రం నల్లగా అవుతుంది డాక్టర్, I think it's tan. No, it's not tan for many people, especially males. It's facial acanthosis. That's also a sign of insulin resistance.
And how common are patients who come with skin tags who definitely have diabetes?
Almost 70-80%.
That's
a lot.
That's a big number, right?
And when I write, why don't you get your diabetes checked? They're like, we don't have diabetes. For my sake, get it checked.
And then 70% of them have diabetes.
Even because for me, I need to promise, మళ్ళీ రాదు కదా డాక్టర్ ఒకసారి తీసేసినాక, బికాస్ రిమూవల్ ఇస్ ద ప్రొసీజర్ దట్ వి డూ. మళ్ళీ రాదు అంటే టు ఫైండ్ అవుట్ యువర్ రికరెన్స్ వాట్ యూ గెట్ ఇట్ చెక్. సో దట్స్ వెన్ దే గెట్ ఇట్ చెక్డ్. And that's when they realize it's like almost 80% is a huge number.
That's a big number.
And then they will be like, oh, అందుకేనా నాకు ఇన్ని రోజుల నుంచి ఇలా అవుతుంది, అందుకేనా ఎన్ని రోజులు నుంచి. They just keep connecting the dots.
నాకు ఎవరు చెప్పలేదు.
They keep connecting the dots back. How did you identify with just one skin tag? So that makes the specialist a specialist.
I know, that's where the difference comes, right? See, because as a physician, we tell them there will be darkening of the skin, but we don't think of diabetes because people are not coming to me directly
from
with a
your
skin
angle
tag.
To think about skin for patients, I don't think they would want to connect. But also when I say they correct it backwards, appudu correct it,
they're reverse integrating.
The physician, he also asked me to do this, and suddenly వచ్చేసాయి తర్వాత నేను ఈ మధ్య ఎక్కువ అన్నం తినేసాను, ఈ మధ్య లావ్ అవుతున్నాను.
Maybe I should have done it 6 months ago.
Like that.
Any hormone issues that go on, like in women, premenopausal, postmenopausal, what are the skin changes that you generally encounter?
So this is usually seen in males, which I told you. Also in females, but mostly in males. The facial acanthosis part and the neck darkening part. For females, when you're looking at hormonal issues, what we usually see is adult acne. They start having acne, especially in the lower face, jawline, and this chala mandi facial hair is normal anukuntaru. Facial hair is not normal. If it is, I mean, normally people do have. If you think it's getting thicker, if you think it's getting darker or visible, chudagane నాకు ఈ మధ్య like people usually try to cut it off. If it is 1 or 2, they pluck it, go for something. And if you think it's coming back quickly, that's one PCOD or hormonal side they have to think. And when you actually when I'm talking about PCOS, of course I'm not a gynecologist, but in the study of PCOS which I have taken, that most of the patients say my cycles are regular, so I don't think I have PCOD. Just don't write PCOD profile for me. So cycles being regular and PCOD are not 100% connected. I'm sure gynecs also would say, and also physicians would say the same thing. So that is not related. The more in the country PCOD vachina valaki 90% signs are on the skin. One is a hair loss that you see. Females ki they will start having widening of the partition or sudden. People actually collect their hair and come to me in the cover.
I lost this much andi.
Ivala Monday idi Tuesday idi Thursday.
Nagu thyroid problem is the usual question with hair.
So won't think of PCOS because the cycles are regular. So hair fall, sudden hair fall, more hair fall, and acne and unna hair thick avadam, unna conditions worse avadam is hormonal changes. They start definitely having belly fat. They will start having this already present areas becoming darker, thicker. And mainly they start going into the side of chronic depressive phase. I'm not changing. Somehow I can see strange changes in my body. I'm not losing my weight quickly as before. I'm not responding to medicines like before. I'm not glowing like before. And avanni kuda those are the signs of hormones. And now when they see, but still my periods are regular, I don't think I have to think about PCOS. Maybe I have thyroid. Maybe I have diabetes. No one thinks of PCOD. So for females, when you see changes happening in your body, in your hair, in your skin, in your nails, if you start seeing early signs of aging, or if you see different changes happening, your facial hair
always
thickening, please think
of
hormones. Don't ever take PCOD so lightly.
So generally when lot of patients who come to me, I generally tell them, when was your last health checkup? The answer invariably is like గుర్తులేదండి.
Or corporate health checkup చేస్తారు కదా అప్పుడు చేపిచేసాం.
So I want the viewers to understand this one point. See, you have only one place to live, your body.
Yeah.
You send your car to service every 6 months or every year. You can't get yourself checked once a year.
I know.
All a health checkup requires, because I love preventive medicine.
Yes.
See, it's easier to identify a problem before it manifests.
I know.
Rather than identify a problem after it has developed and then treat it.
That way you can also prevent us.
I know. Idea is not to do that. But what is a basic preventive checkup?
Yes.
A blood sample, a urine sample,
that's all.
an ECG,
an
ultrasound, an X-ray.
Blood sample ki intik gudu
today we do a health at homes, home care business. I think they are doing phenomenally good service.
So you don't even have to step out of your house.
You don't have to, and not your house. They can come to your car. They can come to your office. They can come to the stair. You don't want anybody to know anywhere. So your CBP, your blood, your urine, your liver, your kidney, your electrolytes, sugar, your vitamin D and B12, cholesterol, thyroid. ECG is now done at home. Now we do X-ray at home. We are doing X-ray at home. All ultrasound I think is allowed, but because it has Doppler, the law does not allow it, because we'll tell the sex of the baby.
It is about to come into.
So that's one. Then so you rather get everything done and know where you are. Where you stand,
know where you are,
because if your cholesterols are towards the higher side, be careful. Start cutting down oil. Yes. Go exercise more. Eat better. Eat what I call a colorful plate: vegetables and fruit. Right? Reduce your carbs. That was always my idea. So when we are able to identify any polycystic ovaries or any of these in our scans, sugar abnormalities. See, the patient himself or herself is better informed. If you are better informed, you want to take care of your health, right? Nobody wants to have a chronic issue later on in life.
And then treat it also chronically.
Because it's easy to control it today and prevent it from happening rather than let go, all let loose, and then you develop diabetes and your thyroids are dysfunctional, and then you look bad, and then you want to go to a nutritionist to lose weight. At the end of it all, or rather at the beginning of it all, it's just what you eat, your lifestyle, your sedentary life, or the lack of activity is, according to me, the major. Apart from the two culprits, which are white powders, your sugar and salt. These, according to me. See, they also say there's a gut and skin axis, right? So what you eat can present eventually after a point of time on your skin, just on your face, like acne that you said. You eat a lot of carbohydrates, sugar is pushed, develop insulin resistance, acne. Can you tell us about this gut?
So gut and skin has a really strong connection. So especially acne patients and eczema, psoriasis, all of these people, we give them, all of the patients, we give them nutritional supplements. Nutritional supplements ichede valaki gut nunchi eltundi because the microbiome is not right. So we usually give
So in other words, microbiome are the organisms that live naturally, which are required to live in your gut. Gut is basically your stomach and intestine, for all of you to understand. Because it's medical terminology, right?
So probiotic system. When you give probiotics, actually, so when this thing started, I was in the pilot study when they were giving probiotics for acne patients. This was 2 years ago. A company came up with probiotics, saying that it's a pilot study, we want to start with you because I'm interested in research. So we started, and actually it's a treatment of acne, regular acne treatment. Along with that, we were adding probiotics because it's easy for patients to take probiotics than to take some medicine, like an antibiotic or something. Instead of antibiotic, I actually cut down antibiotics for patients who have like really huge acne or PCOD, hormonal acne, and started giving them probiotics. They responded really, really well. And also for patients who have chronic psoriasis, chronic eczema cases, when we give omega-3 rich foods, or when we give probiotics plus omega-3 or something with zincovit, so anything nutritional, it's actually repairing, probiotics is repairing all the bad microorganisms with good microorganisms in the body. So that actually shows up on the skin, and whatever conditions, already unna conditions ni kuda, it actually helps in getting rid of them. That's one. Second, if you're having hormonal issues like PCOS in the females, they say eat healthy and do some exercise. Why are we telling to eat healthy is also because that's your lifestyle, you should be, but also it prevents a lot of skin and hair issues as well, and it also helps in having good hair, good skin, and slows down your aging. I don't say it will stop your aging, I cannot say it will reverse your aging, but at least work towards slowing your aging.
Because you can't go backwards in time, but if you can go forward slowly, I'll be happy, right? I'd like to look the way I am looking for the next 20 years.
As slow as possible.
So because there's always been a gut-brain axis, because the gut is like the second brain, because there are neurons in the brain. So in other words, microbiomes are natural organisms that live in generally your stomach, but mainly in your intestine. So when you have loose motions, the doctor gives you Sporlac, right? Those are your microbiomes. Those are your probiotics, which Dr. Alekya Singapore is talking about.
And on that, actually, a lot of patients, they say, normal ఉన్నప్పుడు acne రాదు, chicken తింటే acne వస్తుంది నాకు. Or people who have tinea, తామర ఉన్న వాళ్ళకి కూడా చికెన్ మటన్ తినడం ఆపేసచ్చా, కుछ परहेज है क्या पूछते. So that's not chicken that's giving you acne, because nowadays, not the hen or chicken food that's giving you acne, because it's protein rich. Excess protein and less of other things, less of other calories, fiber diet can also give you acne. But
probably is that
lot of
something?
These are fruits, vegetables, or the farms, the chicken farms, or any farms, they're giving them steroid injections to make them look healthier or to make them look fuller. So when you eat such kind of foods, the steroid injections that these things carry, if they're uncooked properly, those are the ones that are indirectly responsible for patients who are prone to the infection. ఆల్రెడీ అది వచ్చే ఛాన్సెస్ ఉన్న వాళ్ళకి ఇట్లాంటి ఫుడ్స్ తీసుకుంటే ఖచ్చితంగా వస్తాయి, అందరికీ రావు మళ్ళీ.
అంటే ఇన్ఫ్లమేషన్ గోస్ అప్.
Yes, of course,
steroid makes inflammation high,
and you're eating the food with lot of different stuff,
and protein itself causes more inflammation, and mainly meat based protein is more inflammation than
I don't blame the steroid injections per se, But it's a mixture that we're eating, right?
It's the combination that's blowing
the
up.
food is also not healthy, and what goes into the food is not healthy. So in whole, what's going into our body is also not healthy. So that's how you start having. Only chicken తిన్నప్పుడు వస్తుందంటే it's not only chicken. So why don't you check your food? First, మీరు ఫుడ్ ఎక్కడి నుంచి తెచ్చుకుంటున్నారు, what kind of food you're getting, from where you're getting, are you washing it properly, are you cooking it properly, and then are you eating it, what kind of food you're getting it. So that's your gut and skin connection.
That's also
that's
a
your gut
connection.
and brain connection.
See,
and when you're eating protein, it's important that you also have balance it with your fiber. Just protein is not going to help you, and just fiber is not going to help you. Calories, I don't want to talk in front of you.
I know. I watch my plate.
So protein తీసుకున్న వాళ్ళు fiber తీసుకుంటే కూడా it's always better. It's a balance thing.
Balance.
But what do you think about gut brain?
See, according to me, what you put in your body is very important, is very essential. So rather, I'll break it into two things in a simple way for people to understand. There are things that cause inflammation. There are things, foods that don't cause inflammation. Any protein is inflammatory. The less inflammatory protein is vegetable based protein. Like meat, lamb, red meat are high inflammatory protein, hence the acne. Though you see bodybuilders, so it's a combination of growth hormone with a lot of protein supplements, and this whey protein comes from animal.
I don't see bodybuilders coming to me saying they have acne. Yeah, they do have other issues like all that insulin resistance kind of thing. So why do they not get affected?
Oh, they definitely develop acne. They develop, most of them develop all these skin issues because of the high protein content, and then they eat eggs. Eggs are good, but they also take protein supplement, which is whey protein. Whey protein is an animal-based protein.
Will give you acne.
Animal-based protein is highly inflammatory. Hence, whey protein, animal protein causes inflammation, your acne. They are also using, lot of them use growth hormones and steroids. That's why you see hair loss, testosterone levels coming down. You only look manly. But you're less of a man when you abuse steroids. So it's like smoking. It makes you feel like superhuman. But eventually it's going to give you all types of cancer. So these are something that you always have to find a balance with, at least when you come to your protein consumption. And definitely don't use growth hormones and steroids, because they're going to cause problems for you in your life.
I think that's a known fact. Now, andarki idea undochu that hormones to build your body is actually not a safer way to.
Now in Mr. World, Mr. Universe, there are categories where only protein is allowed, and they test you for growth hormone or steroid use.
I think that's also.
So in my honest opinion, steroid use should be completely banned.
Thank you. On that, I'd like to pass on a message also from the skin and hair side. Steroid abuse, especially on the skin. You get this pearl cream, white cream to become fair, and
just removes a peeler.
ante oka 10 days la gora mottam firang aipotaru. I'm sorry for the words that I'm using, but this is the words I hear from the patient. So they apply this cream and they come pettinappudu, they like really like, I don't even know what color is that. It's like a pinkish thingy. And once they stop it, you have to see the bad effects of it. Anything steroid, not just fairness. Even for tinea, even for tamara, ringworm, they use steroid. That's because just go to the store,
pick it up.
Store. అక్కడ అన్నీ ఉంటాయి. It has like 4 things. The steroid cream, and you have an antibiotic, antifungal, and something else. It's a combination of a cream. Just pick it up and apply. Whatever you apply goes. Steroid ఏం పెట్టుకున్నా కూడా పోతుంది. So acne ki steroid use. So stop steroid abuse. Anything which says skin light is not going to lighten up your skin. Anything that says hair growth is not going to make your hair grow. So if anything that has steroid, how would you know it has steroid? Please make sure. Andike, that's why we say take the advice of the dermatologist. Okay, you want to use whatever products you want. How about you check it with your respective specialist and not spoil it, because spoil చేసినాక రిపేర్ చేయడం is a pain. And that's when they'll be like, ఇంత ఇంకా రిపేర్ అవ్వట్లేదు డాక్టర్, ఇంకా రిపేర్ అవ్వట్లేదు అంటే, how did you not ask this question when you're spoiling it?
Yes, because I don't know, for some reason I feel a lot of patients in India prefer their gully ka doctor or the pharmacist there whose idea is to sell the product.
And
he
now
doesn't have your skin at heart.
I know.
But
definitely.
unfortunately in India, they want to wait till the
Because
very
there
end,
is
they
no
want to come to the
consultation in that.
doctor.
There is no
But
consultation line, there is
it's a
nothing.
free consultation over the counter,
They
take
say,
this
"Bhaiya, ye
steroid.
hai, mere ko de do."
And pimple cream. No, it happens for us also.
Really?
Antibiotic use, sir. I went to the
yes.
pharmacist. He gave me azithromycin. He gave me
Plus one
Ciplox. He
Deflocort
gave
10
me
mg.
with this. I went back the next day. He said, take this also. What is that? Deflocort steroid.
2 days is
That's not the way you should treat yourself.
Of
That's
course,
definitely not.
The thing is, it helps, but it's not going to help. You'll just feel a temporary, it's like a placebo effect. Temporary fever taggipoyinattu, temporary infection tagginattu untadi. But taking a steroid and antibiotic just like that, the resistance part of it, the recurrence part of it, the side effect part of it, tarvata meer emani ichina adi pani cheyali. All those things, I don't think a pharmacist is going to educate them.
No, because the pharmacist himself is not educated like the way you are. No, see, we cannot expect.
At least the doctor, the gully ka doctor,
yes,
what you say.
because that's what happens. Then they also go to medical,
lot of many things.
RMP, the medical practitioner.
And nowadays, so it is chat GPT.
And chat GPT. See, there are, even I use chat GPT to get
In a good
information
way, yes.
in the way that I can relate to apply. But it's not like, I'm sure all of us use it, but it's not like, oh, chat GPT said this, use this. No, we don't do that. See, we are only trying to understand and extrapolate it to the situation. We are not a pharmacist over the counter selling your medicine because I have stock.
Yes.
Right?
Yes.
Antibiotic sale, steroid sale should be banned according to me in pharmacy stores. Antibiotic sale, because over the counter everything is sold in India.
Antibiotic
They say
resistance
prescription, but prescription.
prescription చూడరు antibiotic కూడా చూస్తారు.
You walk with me today to 100 stores, all 100 will give you antibiotics
it's
without
only
a
with
prescription.
dermatology.
So no, this happens everywhere. So I say always with a prescription, but that's unfortunately not happening. So the only way the
Tell me
government,
which pharmacist checks a prescription.
nobody checks, right? So that's the reason I say, when that is not happening, which is the way it should happen,
Yes.
stop allowing these stores to sell injectable medication, antibiotics and steroids in a medical store.
How about you start with asking for a prescription and taking it seriously?
That's supposed to have been the way it should be for the last 30 years.
Tomorrow, what if it's your own family? Would you still do that?
That's exactly what I'm saying, that these things have to stop. Now, coming back to skin, see, we know the skin starts to age in people who smoke a lot,
Yes,
in people who are exposed to the sun a lot.
Yes.
What other things should our viewers know that will that they can do to prevent the skin aging? We know if sugars are uncontrolled,
Higher
your
sugars,
skin,
like too
your
much
steroid use is one.
Steroid abuse. And then dehydration. You just don't drink water and you just keep drinking a lot of protein shakes, which I used to do. That also, because dehydration will make your face look dull and then starts giving you those fine lines because of a dehydrated skin, and then that just process goes on.
So on the note of dehydration and hydration, how much water is good for
I
a
would
good
say
skin?
just take, according to, usually I ask weight of the patient, age of the patient and give them, but how about you just keep it to 3 to 4 liters at least minimum per day, like how this gallon bottle is for me. Fill it thrice, I think that should be enough.
That's enough.
And at least to start with, the higher always the better, but not the lesser than that. And we hear a lot of people saying, I drink lots of water, that's why my skin is glowing. And a lot of people make fun of those people who say that. But it's actually true. Drinking lots of water, even if I give them some injections like glutathione injections ఇచ్చాను అనుకోండి, అది అబ్జార్బ్ అవ్వాలి, అది వాళ్ళకి రిజల్ట్ చూపించాలి అన్న, they need to have lot of hydrated. You just can't take glutathione injections or glutathione tablets and think you'll glow, because that will dehydrate you more. Those injections also will dehydrate you more.
Lot of care in the
water.
form of hydration is important.
If you don't want to drink water, drink any form of fluids, your fresh juices, and your, even if you're taking a smoothie, make sure that you add water and not just juice. So anywhere you're trying to keep your hydration at place.
Keep the water
When
should
I say
be
hydration,
flowing.
so that's your drinking hydration part. Another one is moisturizer, which moisturizer and sunscreen is something that I would never ask anyone to skip, no matter what your age is. If you're 1 year and older, just start with moisturizer and sunscreen. That will actually make you age slower and also look younger. So skin hydration is moisturizer and your body hydration is water. even if I drink 5 liters of water, only 2 to 3% of it reaches the upper layer of your skin, like the top layer of your skin. So మీరు 5 లీటర్లు తాగినా 10 లీటర్లు తాగినా when I
there's a very little
when I
that
tell
comes.
patients your skin is not hydrated when we do the facial analysis.
I drink 3 liters, 2 liters.
వాటర్ చాలా తాగుతా డాక్టర్, తాగుతుంది గుడ్, దట్ you'll just pee it out whatever it is. But is it going to affect your skin? It will affect, but not to the extent that you're thinking. So applying a moisturizer will definitely make a difference, and you should learn to apply good moisturizer always on your
That's
skin.
one point
Forever.
I am going to use,
And
which I
sunscreen.
learned, which is moisturizer, which I use
Yeah,
a little bit,
for
but I
males
haven't
it's a
used a
little-
sunscreen in over 2 decades, but I think I should.
Sunscreen phobia, I think all of us have. When you say it'll be sticky,
Because I
it's a
wake up
thing.
at 4:45,
I'm in the house.
Alekya,
Yeah.
but I don't see any sun. By
I
the
actually
time
put
I
up a
come
post
back,
today saying it's raining very heavily in Hyderabad.
Still use
Would you
sunscreen?
still use a sunscreen?
so your answer is you should?
We should.
Sun
And
or rain, you should
sun,
use.
rain, whatever, winter.
So in other
spring.
words, what
It is-
I am taking back from this conversation is, like you brush your teeth, use sunscreen and moisturizer.
Like you drink water, use moisturizer. Like you brush your teeth, apply sunscreen. Because sunscreen is about UV, not about the temperature. వేడిగా ఉంది అంటే ఎండ చాలా ఉంది అంటే నేను ట్యాన్ అయిపోతా సన్స్క్రీన్. నో, సన్స్క్రీన్ ఈజ్ ఫర్ యూవీ డ్యామేజ్ అండ్ ఇట్స్ అన్ ఇండికేషన్ ఫర్ యువర్ యూవీ ప్రెజెన్స్ అండ్ యాబ్సెన్స్. దాన్ని కంట్రోల్ చేయడానికి. బికాస్ ఇట్ ఈస్ రిటర్న్ సన్ స్క్రీన్, పీపుల్ టేక్ ఇట్ లిటరలీ సన్, బట్ ఇట్స్ నాట్ ద సన్, ఇట్స్ ద యూవీ, and UV can penetrate through glass. And it's not the temperature. So if it is hot or not hot, that's a different story.
So sunscreen to be used even when indoor.
Indoors
because
also.
sunscreen is not a screen
All
from
of
the
us are
sun,
indoors, like-
but even
Yeah,
UV
even doctors,
rays that
they're
can
indoors.
hit you.
The people who are working from home are indoors.
I'm going to start using sunscreen.
Sunscreen.
Yeah,
Please take my
I think
recommendation on that.
I'm taking your recommendation on that. See, there was also a concept that drinking 1 glass of wine is good for your heart. And that too red wine.
Yes.
So it's proven that it's not useful at all.
Yes.
No glass of wine, not one drink, none of them are helpful. Rather, they're not even.
Bad news for
Actually, they say they're not good for you. Is there a concept that, because I see a lot of my women friends, 1 glass of wine is good for me, no? What is that a myth? Does it help your skin? Because it's supposed to improve your collagen. Because I tried reading about it, I couldn't find anything anywhere.
About
And I
collagen.
chat GP'd it too, and I couldn't find anything. So,
ChatGPT too.
and I couldn't find anything. I don't know where people get these information from WhatsApps, from their friend. I think they're all drunkards who just want to drink.
Just
But
find a reason to drink.
yeah, but is that true or is that not true? Does drinking a glass of wine help your skin? Yes or no?
Red wine, you mean? Or whatever wine.
Or whichever
So
wine.
what was the talk was, it is the resveratrol, that is the resveratrol ingredient that is in the wine, that will help you glow the next day. But what is the percentage of resveratrol that we are having? Oka glass wine la meeku enta resveratrol undi? How would you just...
Yeah, and then how much alcohol is also
much-
there in it,
how
right?
much you
Which is
gonna drink?
dehydrating you. At one
And you
side
drink
you
when you
want
sleep.
on one side you want to hydrate yourself, and
At the
any
same time-
alcohol is dehydrating.
Yes, of course.
Except beer.
Yeah.
Right, and I don't think this resveratrol is there in beer.
No,
It's
definitely
there,
not.
It's there in wine, so it's not going to help, guys.
So I don't say have red wine for resveratrol for prevent aging, but I say the concept is resveratrol, not collagen. And I don't want to suggest red wine for resveratrol. There are many other.
But you can
ways
take
get it.
collagen directly as a pill,
Why don't
right?
you take collagen powders or collagen drinks or collagen capsules to make
But collagen to kick radi kada. See, that's where I think most
No
of these
comments
things
on
are.
that.
So that's why.
Resveratrol కూడా వేరే డైట్ తీసుకుంటే కూడా కిక్ రాదు కాబట్టి that's a different conversation.
I think
altogether.
people try to find
Some
a reason, right?
Yes. No, but there is a little bit of, they say you have red wine, next day you'll glow, you have white wine, next day you'll glow. So whatever that is, the glow is coming from resveratrol. I'm not talking about alcohol, it's the ingredient that we're looking, and it is not full of resveratrol.
There's some part of-
resveratrol తాగుతున్నా అని చెప్పం కదా, wine తాగుతున్నా అని
Ante.
చెప్పం.
Yeah, that's right.
So resveratrol is a very less percentage, but people, there were studies where people said, oh, in wine there is resveratrol, so that's the reason people
It
get
glows.
glow when next day once they
And so they
drink
just
it.
extrapolated the
Only
resveratrol and to drinking and
so
glowing.
resveratrol కూడా అన్నారు కదా, okay, so wine తాగితే next day glow వస్తుంది అన్నమాట, let's drink a lot of wine and let's just glow up. That's not how it works.
You and me live in Hyderabad, but a lot of people live in Hyderabad and metros. I'd rather say not just the metros, but even towns. Even small places like Ooty, which I go to regularly, is polluted. And you're up in the sky, maybe the UV radiation is high. How bad is pollution affect, and how does it affect your skin?
Oh, that's very, pollution is something that's just gonna just mess up with your skin completely. So one thing is, nowadays we're coming up with sunscreens that also have a special anti-pollution ingredients or anti-pollution care, anti-pollution shield laga. We had to go till there because the regular UV indexes are not helping. The amount of pollution is going high in most of the metro cities, as you said. And definitely not everyone applies sunscreen before leaving their house. And they say, Ajay, enta enda ledu, just apply some day cream, Fair and Lovely, Vico Turmeric, jo bhi hai. Just apply that and go. But that definitely affects your skin in many ways, especially in aging. And those who have acne prone skin, వాళ్ళకి acne వచ్చే chances, clogging of the pores and pollution, all that can actually increase, because pollution also has not just cars or vehicles combust, it also your people who are smoking on the streets, all of it. So it's going to give you your acne. You're doing passive inhaling of all these things, so it's going to just affect your hormonal levels. If it is too much, like too heavy places like your Mumbai or Bangalore, where you have heavier traffic than
vehicular
Hyderabad.
pollution and indoor pollution and
Indoor
all that.
ఎట్లయినా outdoor ఎట్లయినా ఉంటుంది, indoor కూడా ఉంటుంది. So that's going to have mainly on the skin. On the hair, people who suffer already with hair loss, they have this frizzy hair issues, they have this brittle hair issues, the hair starts breaking quickly. So pollution definitely affects your skin and hair. And if you don't have a habit of taking your antioxidants or your water dehydration habits, that's gonna show up definitely on your skin. And తెలిసిపోతుంది వాళ్ళని చూస్తే. Are you someone who's mostly outdoors and no skincare habit? So
yeah, because you can, I know some friends of mine, his name is Sidhu, so he's more of an outdoor adventure kind of a guy. You can tell
that he's
when
been
you
on
look at him
outside,
that
mostly outdoors.
He's been outdoor.
Yeah.
And I also have a good background in car racing. You know that, right? I won many trophies. I have a room full of trophies, not just a closet, a room full of trophies. When I go for those 10 days racing and come back, my skin is dead. Because I've never followed what you told me today. I never realized sunscreen would be so much more important than I thought it was.
Yeah.
And then in that Josh, no cream itself, sunscreen and moisturizing cream ledu. So no moisturizing cream, forget the sunscreen, and then you're out in the day, you come back tired, dehydrated. So now, see one of the most Googled things is hair loss. So what are the genetic associations with hair loss? Is that true? Because I know there is genetic baldness, but I want all the viewers to know how pollution can affect your hair or speeden up your hair loss, how smoking, does alcohol affect hair loss, genetics, pollution, all this. And now they say hair transplant, hair weaving, try minoxidil. Try this tropical oil, this coconut oil. My grandmother's great-grandfather from Himalayas used to have a head full of hair and he used this. So, Anna, you use this. Tell our viewers the real thing, removing the myths.
Yes. So, just to burst most of the myths. One thing is, the main thing, మా నాన్నకి బట్టతల ఉంది, నాకు బట్టతల ఉంది. That actually I'm going to burst the bubble. It's actually it's not paternal, it's maternal. If your mom's brother had bhattatala, that is the chromosome that you're acquiring, and that's going to give you the bhattatala or your baldness. It's not your dad who's giving you this. So stop blaming your father for having a bhattatala. So maybe somebody in there.
So blame your mom now. If you are bald and listen to Alekya, it's not your father is a good gene, your mother is the one who's the culprit if you are bald.
If your husband is having bhattatala, blame your mother.
Blame your mother-in-law if your husband is.
I'm going to get really bad.
Oh, you are going to get. My wife's hiding somewhere. I'm going to call her.
So So yeah, so it's usually maternal. Mummy side nunchi vache gene valla avutundi, not daddy side nunchi vache gene valla. So we mix up for dad is there. So most of the genes that we see, oh he looks like a dad. So usually when we try to compare boys with fathers and girls with mothers, that's not how it goes. So that's the first
In
bubble.
the hair part.
In the hair parts. The first bubble I want to burst there, because it's usually the maternal gene. Now I don't say 100% it's just because of your mom. There are a lot of other things as well, because in my family line, on my mother's side, on my father's side, there were people who had nice batatala. But touch wood, there's no wood. I don't have batatala, or I don't have this hair fall issues. One is because I do take care of my hair well. Second, it is not mandatory that just because someone has baldness in the family that you should have. Same like diabetes. If my father has diabetes, if I take care of my health well,
The chance that you can get it is
so
minimal.
most of the patients now I get very young patients, younger patients.
The younger.
Younger.
And how young are we talking about?
So they come at 20, 21,
See,
18,
that
19.
means they're not taking care of it, or what they ate
18,
for the
19
last
వచ్చి,
20 years is not right.
They were like, of course I'm a doctor, they don't say doctor, they were like, akka na juttu itla enakaki వెళ్ళిపోతున్నది. I'm like, okay, how old are you? 18. And why are you worried about baldness at the age of 18, dude? నాకు hair transplant చేస్తారా? It's just 18. You're just 18. What is hair transplant? You know, it's a surgery. పర్వాలేదు, సర్జరీ అయినా పర్వాలేదు. నాకు హెయిర్ ఇక్కడ వరకు కావాలి, ఇక్కడ వరకు కావాలి, అక్కడ వరకు హెయిర్ ఉండదు ఎవరికి కూడా వస్తాయి.
ఎవరికి ఉండదు.
They're just scared because father has it. I said, how about you rather start some hair care routine? ఇవన్నీ చెప్పకక్క నాకు hair transplant చేసేసి, as you said, hair transplant.
And whatever you do, if you don't take care of your hair, the transplanted hair will
10
also
years
go.
తర్వాత నీకు బట్టతల వస్తే తీసేసిన జుట్టు మళ్ళీ పెరగదు. హెయిర్ ట్రాన్స్ప్లాంట్ చేసిన తర్వాత we take out hair from here and we stitch it here. ఇక్కడ తీసేసిన జుట్టు పెరగదు. సో యూ కమ్ బ్యాక్ టు మీ ఆఫ్టర్ 10 years, నాకు బట్టతల వచ్చేసింది, నాకు హెయిర్ ట్రాన్స్ప్లాంట్ చేయంటే ఎక్కడి నుంచి హెయిర్ ట్రాన్స్ప్లాంట్?
There's nothing left for you to remove, no?
And they be like, beard hair తీసి పెడతారా, బాడీ hair? That's not how it works. So first thing about hair is బట్టతల అంటే వచ్చేస్తుంది ఫ్యామిలీలో. ఫస్ట్ థింగ్ మెటర్నల్. సెకండ్ థింగ్ ఇస్ just because someone in the family has it doesn't mean you should have it. If you can take care of your hair well, hair care routine, you don't have to use serums, minoxidils and all that stuff. Start with hair oil at this age, at this teenage age that they are, 18, 19. I know they all hate applying hair oils. We also used to hate applying hair oils. But use a regular basic coconut oil. That's all I would
enough.
say. Root, I mean, I'm not against any Ayurveda or any root oils or any kind of things. Who cannot or who can also, plain regular oil twice a week should be okay. At least half an hour before you take shower, before you wash your hair is also enough to at least maintain your hair. Intakante basic health inga em cheyalem.
That's enough.
Yeah.
And topical
That's
minoxidil.
more. That's good. If you're going older and if you want to take care of hair, see, I am someone, minoxidil study wise is a very good ingredient in your hair serums, but I'm personally not a fan of minoxidil at all.
Oh, I tried using minoxidil. It didn't help me.
So what happens with minoxidil is something like a steroid. Whenever you use, as long as you use minoxidil, vaadna rojulu juttu baane perugutadi. Once you stop, it will come back to normal. Worse aithe avadu, but it will come back to where you started, back to square one.
What's the point?
So lifelong use cheyandi inka. అట్లా ఉంటుంది.
That's
సో
like that.
why would you want to put a patient through lifelong minoxidil and then suddenly when they stop, ఒక రోజు బోర్ కొట్టేసి ఆపేస్తారు, హెయిర్ ఫాల్ అవుతుంది, మ్యామ్ మళ్ళీ హెయిర్ ఫాల్ స్టార్ట్ అయింది. why did you even start minoxidil is the question. So rather focus on applying some protein based serums which has no minoxidil. Non minoxidil formulas చాలా ఉన్నాయి. And your diet, dude, you don't forget your diet.
In hair loss and inflammation are also hair loss. The more the inflammation, the more the hair loss. So basically take care of what you eat.
The food,
take care
diet.
of your skin. Use a moisturizer, sunscreen, coconut oil. Okay, coconut so oil. We also hear
even for skin coconut oil is still okay. Moisturizer వద్దు అనుకుంటే బాడీ coconut oil పెట్టుకో పడుకో.
చాలా మంది సార్ నేను ఆనియన్ జ్యూస్ వాడచ్చా అంటారు. So what is that? Is that
drink it, eat it, but don't apply it, please.
Right, so onion juice on your hair is a no from Alekya says no.
It's gonna
no, because I get this a lot.
It's going to give you inflammation on the scalp.
I get this a lot.
Yeah. So I don't know who what study they have to do this, but the thing is, people who have alopecia areata, we use something that is irritant. Alopecia areata, Telugu mein kya bolte alopecia areata?
In a particular area, you are losing
pain gorgudu, something they say that is patchy hair loss. So వాళ్ళకి we give treatment that's a stimulant. So anything that's irritating. So we give steroid solutions that they'll apply on the scalp for making the hair grow. ఎందుకంటే its inflammation is going on, we give them anti-inflammatory and makes your hair grow. So that is a concept of making your hair grow.
In that particular area where
in that
you have
particular
lost
condition.
Yeah, in that
alopecia
area,
areata
in
is
that
a
condition. Fair enough.
So now this has jumped in. Onion juice is actually giving you inflammation, which you're applying it on the scalp. It's gonna, so inflammation toni hair fall avutundi. So they try to mess up. Whoever it is, I think got messed up with the
I think
idea.
they got extrapolated this
And then
to that,
onion
and
juice
then
petandi hair growth is natural. The word natural is abused again. So onion ante natural. If I write protein serum, it's not natural. So onion juice petandi.
because they want to listen to their grandma and their friends.
I don't
and
think no one's grandma would have told onion juice. They might have told coconut oil, but onion juice, no, I don't think so. And peptide serums will definitely help you. And vitamins, as you said, when you're doing your health checkups, get your vitamin profile checked. Your vitamin D, vitamin B12, iron deficiency anemia, and vitamin D deficiency is the almost 90%, 95% I should say, are the patients who come with deficiencies.
with basic things that you can fix just with some
Today
basic
morning I had a
medication.
consultation, and I was just talking to the patient, and he said, yeah ma'am, why don't you get your blood tested, because he's saying it's sudden hair fall. Ma'am, I got B12 and D checked because I follow your page. I don't remember when I said this in my page, but because I follow your reels, in that చూసి నేను vitamin B12 and D చేయించుకున్నాను. I said, did you get your iron done? Then he said, I got my iron done, but it's normal. Then I was like, who told you it's normal? It's in the range. What do you mean range? Every diagnostics has their own range. Every hospital will give a different range, 1-2 numbers here and there. Range lo unna ante naku deficiency ledu kada. That's not how it works. So here also I would want to say is, it's not the range that you're inside. You can still have the lowest range of vitamin D, and you still, and range just,
No, it's normal,
it's not
but
like
obviously it's not enough for you.
No,
You
it's
would
like
like
there's
it a
something
little
called,
bit more.
they always focus on deficiency. Please know that there is also called insufficiency. So it's just like నేను just pass అయిపోయినా 35 వచ్చేసింది,
Yeah,
నేను pass
you want to
అయిపోయినా.
get a distinction.
Distinction
not-
of what?
And by the way, medicine passing is 50%. You can't pass medical college with
If
50%.
patients, when they talk like that, it sounds funny when they say నేను పాస్ అయిపోయినా అన్నట్టు మాట్లాడితే. No, that's not how it runs. You don't do నాకు when I write them, okay, you are less in iron. Doctor, where am I less in iron? Show me. This number is not showing up. How are you saying that I'm deficient? I cannot explain to you all everything.
It's difficult. It takes 15 years of doing medicine and then another 10 years of practice to get to where Alekya is got. And she's just beginning off her career. I wouldn't say beginning off, but
It's been 12
she's
years.
still not hit her peak.
Yeah, 12 years.
And it's going to take some more time. See, I started medicine in the year 2000. Yeah, this is
Oh, wow.
2025.
Wow.
Right?
Yeah.
I'm 43, Alekya.
Compared to you, definitely I'm still not there.
So,
But yeah.
See,
So
lot of people think dermatology is only cosmetic.
no, that's
Right?
That's not.
So please enlighten our viewers how beneficial certain dermatological cosmetic procedures are for your health.
Yeah. Now that you've brought the experience here, so let me also want to tell that whoever is just beginning their careers, definitely I'm not beginning my career. I might look very young because of
That you do?
That's because of the skincare habit that I have.
So that's the moisturizer and the sunscreen.
Speaking. So I've been into 12 years of experience so far, and the students, the doctors that I see, the dermats that I see coming out now, just start off with anything without a mentorship is what I feel. Procedures మీరు ఇప్పుడు cosmetology అంటున్నారు, who are non-dermats. Dermats, at least we learn a lot in our colleges, so they are still eligible to do. When you cannot learn a dermatology degree by just doing 1 week fellowship, 10 days fellowship, 6 months fellowship, dermatology I'm talking about, or your cosmetology is what you call.
That's not a
There's
proper-
nothing called cosmetology. There's no word called cosmetology coined according to the law, because there's an anti-quackery thing going on in dermatology where we try to fight with this word called cosmetologist. Asali cosmetologist concept ఏంది? Why did they start up like mushrooms and they're everywhere now?
It's like diabetologists. Like
Yeah.
MBBS, you need to do MD medicine to practice
You just-
diabetes. You just can't do
A fellowship and then become a
6-day
diabetologist.
diploma and call yourself a diabetologist. That does not
That's
work.
weird. That's really weird. So cosmetologists అని చెప్పినప్పుడు you will definitely see 10 days I'll teach you something, one simple procedure, రోజు వచ్చి 10 days నేర్పిస్తే. It's similar to gym. If I teach you how to do your biceps,
can do it yourself.
You do it yourself, but you will not be doing perfectly. You will need a mentor or a
And when a
trainer.
complication comes, shit will
Then-
hit the
then-
ceiling and then everything
Then
goes
you'll run around.
berserk.
So when we are doing procedures, not only complicated, basic procedures, chemical peels. Like the other day, one of my patient came. I'm treating her now. I think for her birthday, it's in October. She went to someone, she herself is an MBBS doctor. This is a funny thing. No offense to her. But I got to know the other day that she's a doctor, or MBBS doctor. నేను కాస్మెటాలజిస్ట్ బీడిఎస్ చదువుకున్నదా ఏదో చేసింది ప్లస్ కాస్మెటాలజీ చేసింది. నో అఫెన్స్ టు బీడిఎస్ పీపుల్, బట్ షీ వెంట్ దేర్ అండ్ షీ గాట్ అ ఫేస్ బర్న్డ్. I said, did they burn your face or did you, what exactly happened? CO2 laser chesa ma'am, scabs form aine anta. She comes with like someone scratched her face. Why did you get a CO2 done without understanding what happens? Because after CO2 you will have scabs. You can't blame the BDS doctor because you didn't ask what happens post procedure. And then వాళ్ళు నాకు ఏం చెప్పలేదు. వాళ్ళు చెప్పలేదమ్మా, మీరు ఎంబీబీఎస్ కదా, మీకు ఐడియా ఉండాలి కదా.
In this world of chat GPT, she could have also chat GPT'd it or Googled it, right?
What is CO2, what happens? And then she comes and then now she's like, my birthday is in 10 days. I've read a lot about you, you're there everywhere on social media. You have to remove these scabs and scars on my face because my birthday is in 1 week. ఓకే, నేను ఎక్కడి నుంచి వచ్చిన మధ్యలో మీరిద్దరు కొట్టుకుని ఐఎమ్ గోయింగ్ టు సూ దట్ బీడిఎస్ డాక్టర్ హూ ఎవర్ షీ ఈస్ అండ్ ఐ వాంట్ యూ టు ఫైట్ ఫర్ మీ. I fight with you.
That's your problem. Yeah, don't involve. See, this is one common thing even I get. Sir, I went to that doctor. He gave me this. My mother didn't improve. In fact, she's worse.
So let's go fight with the doctor.
So, see, any doctor wants to do the best for you.
Yeah.
Nobody wants to treat you lesser or more.
Or spoil
They're
your
going
thing
to treat you in the usual way.
Yes.
Certain complications can occur. Unfortunately, it has occurred with that doctor. It could have very well happened to
With me also.
That does not mean he is wrong and I am right.
know.
So these are things that you have to take with a pinch of salt. See,
And
complications
you
occur.
should have that.
Yeah, you
Doctor
can't.
procedure తర్వాత నేను ఏం చేయాలి? How should I take care of myself?
So it's
You
like
as a doctor.
you can't guarantee me that you will not fall, not be run over by a bus every time you cross the road.
Yes.
Right? The idea is to cross the road, not to be get hit by a bus.
Yes.
But that bus can hit you, right?
So
that's
in this case, I said, Amma, మీరు MBBS చేశారు.
But you have to be smart enough to cross at a zebra crossing when there's a red light, not when there's a green light you run
and then
across.
You run and then you say, bus hit
Right.
me, he's not driving.
So that's partly my fault
My
also.
fault also. So in this case, that's what I'm saying. I told her, మీరు డాక్టర్ని అడిగారా? So she's saying, ma'am, she's BDS, she's not allowed to do procedure. Did you say this before getting the procedure done?
No,
or
but
after you
because
got
some
the
complication has
yeah,
happened,
if
unfortunately
not, you would have
for
gone to
her.
So I said, you cannot blame the doctor. Ma'am, you come with me and you fight with her. నాకేం సంబంధం, మీరిద్దరు
కబాబ్ మే హడ్డీ మనకెందుకు,
మా బాధలు మాకున్నే మమ్మల్ని వదిలేసి. So what happens is when we're doing procedures like this, if you want to call yourself a cosmetologist, know what you're doing, not what the technician is teaching you. Or usually when you buy lasers, the laser company guys will train you basic training. ఇప్పుడు నాకు కూడా ట్రైనింగ్ ఇస్తారు, నేను కూడా ఒక కొత్త మెషిన్ కొంటే డజంట్ మీన్ దట్ ఐమ్ లెర్నింగ్ ఫ్రమ్ దెమ్. ఇట్ మీన్స్ ఐమ్ లెర్నింగ్ హౌ ద మెషిన్ వర్క్స్ ఆర్ హౌ నాకు కావాల్సినట్టు ఈ మెషిన్ ఎట్లా పనిచేస్తుంది అని. వాట్ హ్యాపెన్స్ ఇన్ దిస్ కేస్ హూ డూ దిస్ 10 days, 15 days, 6 months fellowship cosmetologist is they basically rely completely on these laser machine guys or some random people, and they mess up with patients' faces like this. So when you're doing procedures, it is very important, please focus on a certified dermatologist only.
First choose who you want to be treated with well. I think that's the first.
Cosmetologist ane word ledu sir, please. I don't care if someone wants to troll me, whatever that is. Cosmetologist ane word ledu. There is a very strong fight going on from entire dermatology. I'm speaking in Hyderabad at least. The fraternity is fighting very much against this concept for patients good, not for maakem radu, patients face burn అయిపోతుంది. That cosmetology అనే word లేదు. So they can't keep it as dermatologist. So what else can they keep? Skin specialist అని కూడా పెట్టలేదు. So what else can they keep it? They want some specialty.
They got a better sounds
like cosmetologist. So patient come to me, oh ma'am, మీరు dermatologist మీరు cosmetologist కాదా అంటే I'm like, okay, all this is news to me. What am I not? So when we're doing something like microneedling, and they say it in the Instagram reels, you do this thing, you do with the derma pen gun and all that stuff. No, please go to a professional only. If you think your BDS doctor is really good in the knowledge and she's able to do your procedures and she's good certified, and if you are MBBS and sensible enough to go and find out, చేయించుకునేటప్పుడు everybody is sensible enough అండి ఈ మధ్య to know to where they're going and what they're doing.
And there's enough information available.
उतना बुद्धि भी नहीं है कोई कि क्या चल रहा है, suddenly it happened to me ma'am, इतना हो गया. No, that doesn't happen like that. You do your, so when you're coming to me, she said, ma'am, I looked about you, I read about you, I watched your reels. So she did a nice homework about me for 3 months.
But she didn't want to come to you first.
She didn't come to me first. So that's That's actually the point. But so atla, she could have done with the doctor who has spoiled her face. I don't even know if the doctor spoiled the face first of all. I asked, did the doctor do the procedure or the technician do the procedure or I don't know what. I don't even have her prescription, ma'am. Prescription రాయలేదు అంటే అది BDS doctor treat చేయలేదు. So you're unnecessarily blaming BDS doctor, whatever is between both of you.
And there's nothing legally to bind you with that doctor.
No prescription also. I mean, how can someone not? You be a BDS, you be an MBBS also, it's habit that we give a prescription. Yes. No prescription and is definitely something.
Something is off.
Something is happening.
So, ఇప్పుడు microneedling with PRP.
Yeah.
Is that useful?
Yes, of course.
Yes.
So there are times where I travel a lot. And when I feel my face is too exhausted with traveling internationally and come back, just to rejuvenate the skin, to not look, and there is an event immediately, microneedling and PRP actually makes you look good, or it actually repairs your skin.
What should be the duration between the time you get microneedling and PRP on your face?
Oh, you mean the microneedling and PRP of hair?
Hair or the face?
So what we do is combination of microneedling plus PRP. Now we have exosomes. Now we have PDRNs. What's the trending thing is salmon fish DNA and andaru maatladutunnaru on Instagram. So that's your exosomes, your PDRNs, and ivanni kuda when you do microneedling and then you apply the product. It could be PRP as well. So microneedling is actually causing the channels, the pores to open up in your skin. It will help it as a channel to let whatever product you're applying to go into your skin. So gap చూస్తే face పైన చేస్తే you at least need your skin to revive, so at least give 4 to 6 weeks gap.
4 to 6
if
weeks
you're getting
is the
only
duration.
PRP on the hair, 3 weeks is sufficient.
So if you girls want to look nicer and you have 6 weeks time, you can do a microneedling with PRP of your face.
Yes.
But it should not be anything less than 6 weeks. And
మధ్యలో కూడా no procedures.
And yes, PRP and microneedling
Can
of
be
the
done
face
together.
is useful.
It is
ఇప్పుడు
useful
there's
with
also
generative
this Korean people.
Korean glass skin.
I think K beauty or
K-beauty,
porcelain
Korean
skin or
skin,
K
glass
skin.
skin.
Is it a fad? I know it's a fad because it's trending. I know it's trending.
Everyone talks about that.
And I don't know I don't want to look like, I don't want my wife to look like a Barbie doll. Neither would I like any
No
woman
offense
friend
to
of
Barbies.
mine to look like that. It is a Barbie doll, right? And I don't want you guys to look like Korean. So
No one wants to look like someone else. You just have to be yourself.
So all these are all. Is that really their skin or all Instagram face filters?
So the thing is, face filters definitely. Second thing is, you can look better and really good than what you are with the treatments, but I cannot make you Korean.
Yeah, you can't.
I can make you better Dr. Chaitanya, better looking Dr. Chaitanya, or younger looking Dr. Chaitanya, but not a Korean Dr. Chaitanya.
That you answered. See, now AI is coming in. AI is what? Artificial intelligence. What do you think will be the developments that you will see in your practice or your colleagues in dermatology with AI?
So that's a very interesting question. I've done my MBA from ISB recently. So
apart from your dermatology MBBS and dermatology degree, you're also an MBA.
Yes.
Oh, that's news to me. I didn't know that. So obviously,
Really?
I don't really
Wow.
know her that well.
Thanks for the disclaimer.
Thanks for telling me, rather.
So I've done my MBA from ISB recently. There we were actually trying to do a project. We do something called an ALP, where we try to do a project that we can take it live after doing our MBA finished in Tarot. I did it in hospital management. So dantlo we were looking more because AI is the trend now. So we're trying to see how AI can actually help you make your skin better. And also in dermatology, how it can help you. One is the machine that I have already, which is called face analyzer. You just remember Chinnappudu, when we were Chinnappudu, when there was something called exhibition thingy, and then there was a computer, and you just put your face there and just reads your face. So something similar now, you have face analysis machine where you put your face, it reads out like some 200 elements of what your skin is made out of. What's your skin type, is there a dandruff, you have open pores, you have dark circles, you have this, you have that. It just gives you a chart of things.
Skin tags and insulin resistance and stuff like that. Many things, 200
it doesn't
readings.
give that yet, but it also gives what you require. So based on that are my prescriptions. So patients also know that I'm not just writing whatever is on my mind or trying to sell products from my pharmacy. They know that they need it. It shows what is in the red sign, what is in the blue sign, what is yellow. which is really required. వాళ్ళకి రాసిస్తాము. So that is one AI which I saw. Second thing what I've seen is with AI it's like you can also use your app where where your app or like your Siri or your Google My Home will remind you ki sunscreen petkoledu ivala. I wish it goes there. Do you need a sunscreen on your face? You're aging
that
faster.
I think we can also do it like a regular alarm in your Alexa. But this will be integrated into a set of many other things.
Like how you have your wristwatch and how you have this Gabbett ring, it will just keep tracking how your skin is, how your body temperature or your
so it can also see your hydration of your skin and
it does now. I have a hydration detector, I have a skin analyzer, and I have a lot of things individually. I wish we have a combination of all these things.
And it's going to happen sooner or later. So it will happen sooner than later.
Yeah, and also the procedures that we're doing. The procedures that we're doing is when there are machines where you just type in whatever the patient's requirements are, and the machine itself will tell ki kaun se procedure acha. This is a really good procedure for the skin of so and so person.
For that particular skin, that particular
age also. For this skin, this procedure works better, and this many sessions will make a skin better.
And it obviously is analyzing the skin.
It's analyzing and then answering.
With artificial intelligence and telling you this procedure done X number of times will benefit you. And this might not be the same for me or for you.
It will also show you before after. Okay. This is before.
So
and
you
this
can
is
choose. And do you think in the future AI will replace a dermatologist?
No.
No. Okay.
Never. I will not let it also.
No, because I personally feel AI will take over a lot of medical work.
Yeah, medical in general.
In the near future, in my opinion, 3 to 5 years, there will be a sea change that I feel will happen in healthcare. Starting with radiology, some extent of dermatology, and a good amount of general physician work where we follow an algorithm.
So is it like ChatGPT which is basically doing right now?
It will
kind of.
It will ask you leading questions, and then it will point out this is the probable 1, 2, 3, 4 diagnosis.
See, probability can always be a probability only.
But it needs to be certified by a doctor. Otherwise, you are going to not a hospital, but you are going to like a car service station. You are going to a human service station.
As a human being, if a patient comes to me and tells me I have acne, if there is a robo beside me, I'll just write the prescription. As a human being, I can understand what she's going through
because the background part of it. So in other words, AI will definitely aid you. It might not replace you anytime soon.
Yes.
Okay. So we'll talk a little bit about our diet, our regular habits, which are good or bad for you.
Or in general?
In general.
I don't want to talk about mine.
In general, diet and habits that are good or bad for your skin and hair.
Yes.
See, generally, what is one good habit for good hair? You already told me at least coconut water hydrating well. For good skin, you said moisturizing cream, sunscreen, even if you're sitting indoor.
Yes.
So I have answered the first question also because you already put that in my head. See, is sugar really bad for your skin?
Yes.
Sugar is bad for your skin. Inflammation again?
Yes.
Okay.
Especially acne prone skin.
So if you want a good healthy skin, what should I avoid in my diet?
As I said, any kind of sugars, deep fried food, and too much of cheesy, oily food, you need to definitely avoid. And include it with so even if you want to eat too much of sweets, I have a very high sweet tooth. I can afford eating sweets for breakfast.
Yeah, look at you, right?
Yeah, just sweets for breakfast. Just listen to me telling this, and you can judge me later, but beat me
ideally
later.
You should avoid. See that once in a while we don't want you.
No, I'm saying
I
can.
Life,
I did not say I will. I can. I mean, anta sweet tooth untadi, but I know that sugars are bad, so we try to avoid it. Like if I ate so much of sweet, what am I going to do for the next of the day? I can't keep just eating sweet
all day.
So we're going to compensate this with something else. So sugars definitely are not good for your skin, and your in general body health. And if your habits of always touching your face, of always doing something, those
should come down.
definitely, because we don't know what we are touching on the
Yeah,
skin.
it's generally it's all infection, right? So we are touching
even
everything.
in hospital, even if I sanitize my
Oh,
hand,
hospital is one of the dirtiest places
first
because
place you can
everybody
actually
with
catch
an infection comes to a hospital and there generally the infection level is high. That is the reason why we take so many vaccines regularly to
And you keep
protect,
wearing the
and then
mask.
America says no vaccines anymore. You know, I find it very silly.
Yeah.
See, we know collagen is good for you. We
Food
know
law,
glutathione helps you.
No, I don't think, glutathione helps, but I think we abuse glutathione so much, so much. Like, everybody just pops it for the sake of, and India lo una stigma of nallaga undadam, tellaga undadam, and I think just take glutathione tellaga aipotaru. So just keep popping it. That's not how it works. There is a dosage that you take, and there is a way you need to take, and there is. మీరు వాటర్ తాగకుండా రోజుకి 1000 mg of glutathione తీసుకోండి, you will still be dehydrated, still look
hydration
darker.
with glutathione helps, not just glutathione, and glutathione has to be calculated based on your height,
so
weight,
for which
age.
you will need your specialist again. You can't randomly look at stuff and pharmacists say ఇది మంచి brand మనం వేసేసుకొని.
That's what happens. So they want to call XYZ medical store, ghar ko bhija de, one box comes, they call us home care. That's not how it works.
That's not how it works.
And does biotin help?
Yes, biotin for hair definitely helps, but what is the mg? Because there's a lot of biotin capsules that we see that they take. What is the mg of biotin that you're taking also matters, which requires a consultation for that also. And your collagen helps in your aging and reversing or slowing down your aging. Now, sorry for using the word reversing.
And that's important.
Yeah, but keeping all these things aside, healthy diet, which, as you said, a colorful plate, makes a major difference in your body. At the same time, skin and hair, it shows on your skin. Whatever you eat shows on your skin. That's the first thing that you see. And the last 2-3 months, I due to some reasons I was not eating on time because I was traveling, and by the time I came back, all my employees were like, me face la dullness confused. Even like I just was asking, is my face looking dull still? It's like, yeah, daily your face is looking dull. And then when I checked with my mom, she's like, you didn't eat anything probably last 2-3 days. Traveling, tension, stress, because I'm traveling, and in the flight, whatever they give you eat. And when you're traveling so much, whichever country you're in, you just eat. There is no selective process sometimes. And when I'm training, when I'm rushing around, it actually reflected on my face for a really good time. And for me to correct just basic diet.
Takes a while again.
It took a only diet. It's not like I tried something on my face. It's not like I got some procedure
it's just
on
the
my
nutrition.
face. Nutrition actually can make good and also bad. So I say food, definitely what you eat, your gut makes a huge difference. So avoid these wherever you are, how tempting it is. Sugars, sweets.
Avoid all that.
Sodas.
I always say avoid sugar, salt, anything that comes in a plastic wrapper, your Uncle Chips, your Lays, your biscuits, your
Sodas?
canned Coca-Colas, your canned Sprite, all of that you avoid. See, nicotinamide adenine dinucleotide, NAD.
Yes.
Oh, you know how many people call me for that?
I think at that point I called you too.
Yes, you did too.
Like,
And
hey,
it's
did you hear what this
unbelievable the number of people who have called me. I've read so many studies on it.
Yes.
It is useful. Anything it helps the skin.
Yes,
in
in
any
NAD, I don't think it helps skin per se, but yes, NAD is known to. I'm still doing a research. As I said,
even I'm doing my research on it. I've not been able to come to a pinpoint conclusion on how it helps, but I know it helps.
So we have done this thing called telomere testing. One of the diagnostics is associated.
Reduces the shortening.
Yeah, so it actually shows कि age difference होता है, reversal of aging, not like some 50 to 10, 50 years age to 10 years, but a bit of reversal of aging. That I think you can achieve with your diet, your exercise, your good healthy lifestyle.
That itself is enough.
But if you want to go beyond, NAD do help. But NAD ni abuse చేసేస్తున్నారు కదా, అది కూడా. Everyone just injects it.
ఇప్పుడు నేను this Brian Johnson, right? I don't want to live to 150, yeah. Right? I don't know why people want to live forever. You're not built to live forever. Right? Your human body is not a machine where you can replace something. It is a God-made creation if you believe in God. And everything has a time frame. That time frame can be prolonged.
Yes.
Cannot be prolonged forever. Your body is not defined. What's the point of living like a vegetable on a bed, not able to walk, not able to feed yourself, not use the bathroom by self? You need support. Live life king size. But don't abuse your body calling it king size. I'm manly, I smoke a
That's what I
cigarette,
mean.
but that's not the way to do it either.
Abuse it, calling it king size.
Right? So we'll come to the rapid fire question.
Rapid fire.
So we're entering the rapid fire.
Wow, do I get a
So-
hamper after this?
No, this is not coffee with Karan. This is
I will still
rapid
grab
fire
some
with
ham.
Chaitanya, the poor doctor. So, morning skincare routine or nighttime skincare routine?
Morning
Morning.
skincare.
Sunscreen or moisturizer? If you had to pick one, knowing that you like both. So you say both.
Sunscreen with the moisturizer
With
effect.
moisturizer. See, she's smart, right? Chemical peel or laser for a beginner?
Chemical peel.
Best oil for your scalp?
Coconut oil.
A celebrity whose skin you admire?
Whose skin I admire? No. I'm sorry. Nobody.
Nobody? Okay. What's the weirdest skincare myth that you heard from your patient? Like onion juice pedte hair berugutadi. Like
weirdest,
that weirdest.
Recent Gavina, they mixed, I think I made a reel also on that. They mixed baking soda with vodka.
I heard beer for your hair, but
No,
baking soda with vodka.
on a child, dude. On a child. ఎందుకు అంటే పెయిన్లో ఉన్నాయని పెయిన్లో చచ్చిపోడు పక్కన పెట్టు వాడు మనిషి ఎట్లున్నాడు
Baking soda itself is bad, and then you wasted the vodka for sure.
That is the weirdest thing. I never thought of the combination.
Wow,
I
that's a
thought
first for
vodka
me. I've
and
never-
baking soda might just burn or
I'm sure
has
it
a chemical
burns.
burn.
That's sad.
That's the weirdest myth.
See, as a dermatologist, do you feel pressured that you should be looking flawless, or your skin should be looking
Yeah,
flawless?
I used to.
But after a point, it doesn't bother
After a
you
point, I
anymore.
realized that I'm treating patients and I'm taking care of my skincare. So I'm treating patients. I don't have to be pressured to look certain way as long as I'm making people look
And
certain way.
your results speak for yourself.
Yeah, and వాళ్ళు నా గురించి ఒపీనియన్ చేసుకోకూడదు because I'm helping them. Come on, you cannot opinionate a person who's helping you.
So, one skincare treatment you'll never do to yourself, no matter what. What you won't do
I will never do a
on yourself.
Skincare like what? Product or skincare?
Any skincare product. Like
any
it could
skincare.
be.
I would never sleep without moisturizer on my face or getting my skin cleansed out of my whatever is there on my face, makeup or non-makeup or whatever.
From the
Without
pollution
cleansing.
to whatever, clean up your face.
Night double cleansing lekunda, moisturizer lekunda, I will not fall asleep. Even if I'm exhausted and want to sleep, I'll just go to the washroom, dump my face, wash and then apply moisturizer.
So that's something that I should do too.
Yeah.
If
Because-
I want to look any
because that is
prettier
the
than
time-
I am.
That is the time your skin rests. So whatever you apply on your face gets absorbed without disturbance or pollution.
And
So-
you're in bed and there's
Yeah,
7-8 hours
you
of
just like-
sleep, so
and you're in
everything gets
rest.
absorbed. And hydration, obviously. is
Hydration and you're in rest. So that I would never do without cleansing my face. I'll never go to sleep.
So, Alekya, thanks for coming on this podcast.
That is my hamper.
I'm sure I learnt a couple things from you. Me being a doctor itself, I learnt a few things that I should be doing, like moisturizing every day with a sunscreen, not either or, but both. Even if I'm indoor, drink a lot of water, 3 to 4 liters of water, and only 2-3% of the water you drink reaches your skin. Right? So drink as much as possible. Don't gulp water, sip on water. That's what she's been doing all through this podcast. Obviously, we can't show you that.
Thank you.
But yeah, and what your pollution affects your skin. Clean your face up every day in the evening. Moisturize your skin before you hit the bed. Drink good amount of
Coconut
water.
oil.
And coconut oil for your hair. No baking soda with vodka. Yeah, don't
Please don't
waste
waste
all
both.
that. Don't trouble the little one. None of that helps.
Don't waste both.
So any of your skin issues, hair issues, you want to look prettier than you are, that's the person you should
Thank
go to,
you.
and we'll give you all the details up here. I am Chaitanya, and thank you,
Thank
Alekya,
you so
for
much for
coming
the
here on
wonderful
this.
podcast.
Thank you.
I'm missing out my hamper.
We will figure a hamper out for you next
Thank
time.
you so much. Thank you.
That is it.